might have heard that you need a valve replacement. So what is this whole business about valve problems in the heart? Well, remember, the heart's basically a pump on a mechanical level. It's pumping and it's got to have valves inside it to make sure the blood's going in the right direction up to your brain, into your body. So these valves, especially on the left side of the heart, you might have heard of quite a bit, like aortic valve with aortic stenosis, which is basically narrowing or stiffness of a valve. So as the heart pumps, that valve has to open to let the blood eject out, and the aortic valve can become stiff and not let it eject out. Especially in older patients, this valve problem called aortic stenosis is something we're treating more and more commonly with a catheter type procedure instead of an open procedure. Traditionally, open heart surgery, you open up the chest, crack it open, expose the aortic valve, and replace it with one of these mechanical valves that gets replaced. Well, now we use catheter procedures in a lot of them. That's where you use this catheter, go up the artery in the groin by the femoral site, which is basically by the hip, run the catheter up, which is a long skinny tube with the valve at the end of the catheter. Place it across the stiff stenosed valve that's not opening right, but place it across there, crush that valve open, and leave behind a brand new valve. That's called TAVR, transcutaneous aortic valve replacement. Another valve procedure, this mitral valve leakiness. Mitral valve, that's the valve at the bottom left ventricle chamber and keeps the blood from going backwards, gets too leaky. And then you have to do surgical repair still most of the time. But in some patients, we even use the catheters to go up in there and use a little stitch device to make it function better and leave a clip in there. And the clip keeps it from leaking too much in a backwards fashion. So, in summary, your heart is a pump. It has valves that keep it functioning so the blood goes to the brain and to the body in the proper ways. If the valve, the aortic valve, gets stiff or can't open right, we replace it with open heart surgery, or more commonly now with a catheter, transcutaneous aortic valve, TAVR. Mitral valve, it's leaking backwards. We can repair it with open heart surgery as well, or now, as patients get older and can't maybe get open heart surgery, we use a clip type device to keep it from leaking backwards.